meeting and ask for a roll call, please.
Mayor Giles,
Here.
Councilmember Holmes, it doesn't look like that Melanie is on yet, so she's absent. Councilmember Nielsen,
Yes.
Councilmember Machezik,
Present.
and Councilmember Sowers. I know he was going to join us via the phone. Let me see if I see him on there. I do not see him, so Councilmember Sowers is also absent.
All right, I'm hoping that someone will, as we start our meeting, stay on schedule, that someone could try to track down those two people, Melanie and Tom, see if they can join us. Let me review, kind of give you the highlights of how we'll conduct tonight's meeting. So the business agenda is for the council, city council, to consider adopting a resolution supporting a requirement to wear face coverings in public places in response to the COVID-19 community spread. This is an action item. We have two versions of a resolution. I would characterize both of them as they have the same goal, but they are very different. There are two clear choices before council tonight. Both of them attempt to reduce the spread of COVID-19 and address public safety in a situation where we have community spread. So it's a very important issue that we're thinking about tonight. As I said earlier, there's two clear choices. Option one uses language that urges people to do the right thing. Option two uses language such as mandating people to do the right thing. And they are very different, those two choices. Council has had an opportunity to review all the wording. We have had a very robust series of input today from many of our citizens that do business in McCall and that live here and that visit. So I think we're well informed. We have great information, and I wanted to thank Bessie Jo and Annette for making that happen. So I think it's timely that we will be able to make an informed decision as a council tonight. Our first step will be to start with a 5-minute briefing from Dr. Greg Irvin from St. Luke's McCall. From there, we will move into deliberation, where I will call on each council member one at a time, and I will ask them their preference for whether they would like to proceed with option one or option two, and whether edits are needed to any of those, to either of those two options. At that point, we'll get an idea of where council is leaning, and then we will proceed into the formal process of passing one of those two resolutions. Dr. Irvin, would you lead us off, please? You have 5 minutes.
His phone is probably muted, so he'll need to unmute by hitting *6, and then it will take 20 to 30 seconds to unmute.
Thank you, Bessie Jo.
And Mayor, while you're waiting for Dr. Irvin to come on the line, I'd just like to also let the council know that the city attorney, Bill Nichols, is on the line. So as you work through these resolutions and have any questions for him regarding your legal authorities or what the definitions are in these resolutions, or any questions about what the terms mean and how it works, please feel free to ask, and we have Bill on the line to help you with that.
Thank you, Annette. Thanks, Bill, for joining us, because I'm sure we'll have some questions.
Still on?
Excuse me, Bob, this is Melanie. Can you hear me?
Yes, thanks for joining us, Melanie. We just laid out the agenda for tonight, and thank you for checking in.
Yeah, actually, I've been here. I didn't get in until 5:02. I just wanted you to know I was here.
Thank you very much.
Mm-hmm.
Have we heard from Tom? Is he able to join us tonight?
Yes, I just sent him the phone information so he could phone in.
Thank you, Bessie Joe. Would someone please try to reach Dr. Irvin?
Sure, I do see a 2221 number, which is the hospital. So I was hoping that was Dr. Irvin, but it still shows as muted. So Dr. Irvin, if you can hear me and you're calling from the hospital, please *6 your phone.
Hey, Bessie Joe, this is Tom. Can you hear me?
I can hear you, Tom.
Hey, Tom,
Okay.
Thanks for joining us. We can hear you well.
Oh, perfect.
Bessie Joe, there's another phone number that Dr. Irvin has used previously that ends in 3170. Do you see that one on the line by any chance?
Is it a 634 number?
No. I'm texting him right now.
Okay, I do not see it.
It's possible he's hung up with something at the hospital.
Ned, I also emailed him just in case he was trying to get through and was on the email as well.
Okay.
Respect.
While we're waiting for Dr. Irvin, I have a question for council, and I'll call on you one at a time. Have you had a chance to review in the packet not only the two versions of the resolution, but have you had a chance to scan through public comment? So let me start with Colby. Have you had a chance to do that?
Yeah, I've been reading away feverishly here. There's lots of public comment.
Yeah, there is. Tom, have you had a chance to scan some of that and look at people's opinions?
Yeah, I've read through most of it.
Thank you.
Just what we got, just here at the very last minute, I haven't read.
Yeah, Melanie, do you have a chance to review that?
I sure did. Thank you very much.
Good. Mike?
Yes, I've reviewed all of the letters and public comments, as well as the proposed or to be discussed resolution and ordinance.
Thank you. I want to compliment council on a lot of this was last minute, and I appreciate you taking this seriously and doing your homework. I think it's really important that we make informed decisions, and you've been very good about doing that. I appreciate your diligence on that. Have we been able to reach Dr. Irvin?
I am here.
Hi, Greg. This is Bob Giles, Mayor of McCall.
Hey, Bob, I hear you.
I was going to ask you if you could lead us off. We will be considering tonight two versions of a resolution. The first one uses language to urge people to do the right thing. The second version uses language that mandates people to do the right thing, and it has a $100 fine associated with it. So I would like to hear your thoughts, Dr. Irvin, about the subject we're going to embark on, the two resolutions.
Sure. Well, thank you for having me. I'm sorry I'm late. I was tied up with patients and just literally came out of an exam room. I have been, as you know, a zealot about the issue of masking related to the coronavirus pandemic. I am that way because we have limited tools in our ability to reduce the risk of COVID to our populace, to our people, and I care greatly about the people of Valley County and West Central Idaho, and have for a long, long time since I came here. We have our ability to deal with coronavirus right now is related entirely to preventing spread of the disease. We have no meaningful treatment. We have convalescent plasma. We have remdesivir. We have pulmonary support for people that get very sick with COVID, but we don't have a smoking gun treatment, and we don't have a vaccine. What we're trying to do is reduce disease spread as quickly as we can and as well as we can to hold on and keep as many people safe and healthy in Valley County and McCall as we can until we have a treatment or a vaccine. And quite frankly, either one will help us greatly. If we have a treatment that can reduce the 1.3% case fatality rate for COVID-19 for symptomatic patients, that will help a lot because we won't be having people dying. And if we can get a vaccine that that creates herd immunity through the vaccine mechanism, that will help. To get herd immunity from people catching the virus will take us many months or years, and we will lose many lives. If the case fatality rate is 1.3%, and let's say it's 1% for the virus, to make the math simple, and we have 3.4 million people in the United States, that means that 340 million people in the United States, that means 3.4 million people will need to die in order to get herd immunity. Now that math is very rough and very off the cuff. There are a lot of factors that would go into that, but it would take us a long time and a lot of deaths, needless to say, to get herd immunity. We've had 125,000 deaths in the United States already. So I'm a zealot about doing everything humanly possible to prevent the spread. We know that masks work. We have good data, solid data, scientifically validated data say that face coverings reduce the risk of spread. And if both members of any encounter are wearing a face covering, even a surgical mask or a fabric face covering, it reduces the risk of spread of the virally infected droplets that emit from a crowd, like a cloud, anytime we talk or breathe, that it reduces that spread by 85 to 95%. if we just as the simple measure of doing the 4 things we know to do, isolating when sick, socially distancing, doing good hand hygiene, and wearing face coverings, if we did those things consistently and with a significant percentage of the population doing it, we would reduce disease spread dramatically in this country, and we would get safely to a vaccine or a treatment, and we could keep our businesses open and continue to function as a society, which is very important to all of us. So I believe that's why I contacted the city council, is that I believe that we're not seeing, this has become an unfortunate political issue, and we're not seeing people voluntarily wearing masks in public at a rate that we need to see them. That I believe a mandate is necessary to encourage people to do that. I think if we simply make a recommendation, it's exactly what we have now, which we will get the 50% or whatever of folks that are wearing masks in public, and that's all we'll get. And we need more than that. We have the opportunity to make a major difference with the influx of summer residents and visitors to McCall this summer, to make a very difference in disease spread in this community. I strongly recommend that the council consider mandating, with a simple $100 fine, face coverings in public issues. And my entire medical staff is on board with that. We have nobody on the medical staff that doesn't feel that way.
Thank you, Dr. Irvin. Before I poll each member of the city council, I would like to provide them an opportunity. They may have some follow-up questions or some thoughts they wanted to ask you some questions. So let me start. So let me do that. And then I'd like you to stay online because there might be some questions as we deliberate. And thank you very much for really succinctly explaining why you feel that way. So let me start with Mike Machezik. Do you have any questions for Dr. Irvin?
Thank you, Bob. Yes, Dr. Irvin, the one question I guess that we have been hearing that maybe you can respond to as well is just what do we have more opportunities to disseminate information and help keep our community informed as to the reality of what's going on in our community as it relates to the coronavirus, relative to the discussion that we had last night, where we're seeing, a small number of cases on the Central District Health website related to Valley County, but we're also aware that there's significantly more cases here. And are there any other opportunities from the healthcare system to help communicate with our public what's going on in a more timely fashion?
Yeah, Amber Green, who I know spoke to you yesterday, and the rest of the medical staff are working with the system to develop a better form of messaging. We're all learning, like everybody else is, about how to deal with all of this. And we are working with St. Luke's Health System to improve messaging and to get information out to the public, presumably as early as tomorrow. Because I think it's important that the public know. Now, that said, I can tell you that based on the testing that we've done at St. Luke's McCall Hospital, that we have a definite increase in cases in McCall in the last week and in Valley County, and that we have community spread. And community spread is the important nomenclature. It's the important concept to understand, is that the virus initially, when we first saw it arrive in Valley County 2 or 3 weeks ago, was isolated cases of people that had come from elsewhere and became ill while they were here, and we diagnosed them as having it, got them isolated, got them put into quarantine. But now we know we have spread from one person to another in Valley County. And once any place has that, it means that anybody could have it, irrespective of what the testing is. We have a large number of cases that we've tested and that others have tested, such as Crush the Curve and so on, that we are fully aware of and that Central District Health is aware of. And I think Central District talked to you yesterday. We have cases in Valley County, and we know it's spreading freely here in the county now. So the important thing is that we know that we have community spread, and we know that anybody, me, Bob, you, anybody that you come in contact with could potentially be shedding virus right now and not know it. So once you have community spread, the game changes, and you take universal precautions, and you assume that anybody you're talking to that's breathing on you, anything, could potentially infect one or the other in that encounter. And that's why masks are so important, and that's why universal masking is so important, is that once you have community spread, it's important that we all assume that anybody could be shedding virus, and that's quite literally true. I might be spitting virus on this microphone right now. I hope not.
Thank you, Dr. Urban. Mike, did you have any other questions?
I don't have any other questions, and thank you very much, Doctor, and thank you for all of your participation and care for our community.
No, I appreciate that. Thanks for saying so.
Melanie, you're next.
Honestly, my comments would have strongly mirrored Mike's questions and comments. So I feel like I have very little question right now, but I would also like to strongly thank Dr. Irvin for all he's doing.
Appreciate that. Colby, you're next.
All right. Thanks, Dr. Irvin, for all that you've been doing through this.
Thanks, Colby.
You know, I guess the question I have is to kind of address what we're seeing a lot in these public comments, which, you know, if anyone pays attention to anything, they've heard them before. But would you be able to address for us the virtues of wearing masks and possibly speaking to the notion that masks do more harm than good, and kind of the fear of the mask, and maybe help dispel some of those concerns?
Sure. Yeah, I'd love to talk about that. You have to know, Colby, that I am at some level a libertarian at heart. I believe that we all make our own decisions for our own best interest, and that we should be allowed to do so. I think that it's wise and appropriate for a motorcyclist, for example, to wear a helmet when they ride a motorcycle. But if they choose not to, the only person that they harm is themselves. And if they choose to do that, I think that I certainly would wear a helmet if I rode a motorcycle. But I think people should make their own decisions in that regard. The conundrum we have with masks is that the reason to wear a mask is to protect others. The person wearing the mask is the one that's protecting the person that they're talking to or interacting with, and so on. And now it becomes an issue of being your brother's keeper. It's a matter of public health and public safety. It's not you that's being protected by the mask as much as it is the person you're interacting with. And then it becomes a whole nother issue, because that person deserves to be protected just like you deserve to be protected. So this doesn't become a matter of civil liberties, in my opinion. It becomes a matter of public health. We know that masks reduce the risk of viral spread. That's been very, very well documented by multiple experiments. I can refer you, if you're interested, to some websites that show the micro droplets that come out of us every time we speak. It's pretty amazing how much comes out of our mouth with each word. And having a mask catches the vast majority of those viral particles, those droplets that contain the virus, and contains them within the mask and prevents them from being aerosolized into the environment around you. And so that's what's important about that. In terms of safety of masks, I wear a mask every day of my life because I'm a surgeon. I've done that since I was in my mid-20s working as a surgical resident at the University of Michigan. I wear a mask all day, every day in the operating room. I know of no surgeon on earth that has ever had any problems with breathing their own air or all the other things you hear about how masks are bad for you. That's just not true. There is nothing that has ever shown that breathing through a mask creates any problems. And so there's a lot going on in social media and in people speaking about this, about how they don't want to wear masks because they're not good for them. There's no science to that whatsoever. Absolutely none.
Yeah, thanks for addressing that. Then I have one more question. I guess if we were able to, take ourselves out of, the political aspect of this and look at if we were to re-flatten our curve or help eliminate the spread of this virus, what's more effective? Completely shutting everything down and reinstating a stay-at-home order, or wearing masks?
Well, obviously, if everybody stayed home and we shut our economy down again, that's going to be more effective than wearing masks. But none of us wants to do that, myself included. We have to function in society. We have to try to keep our economy open. We have to allow people to make a living and to do what they do every day. I'm dedicated to that. And I think that if we follow these basic precepts of preventing viral or reducing viral spread, we can keep our economy open and protect public health and safety. I don't think we all need to go back to our caves and roll the rock over the front and stay there. I think that would, quite frankly, be very detrimental to society and very detrimental to people's mental health and welfare and their economic health and so on. And I'm absolutely convinced that we can do that with proper, and it's not just masks, it's everything else we've talked about. But I think we can do that and keep the economy open and keep it functioning. It just takes, some inconvenience. None of us likes wearing a mask in public, but it takes some inconvenience and so on. And there are communities all over Idaho and the Rocky Mountain West that are doing that. I just read today that Moscow, Idaho has imposed a masking order. I know that Park City, Utah has, and Summit County. I know that Jackson, Wyoming has. There are many places where that's been the case. And if we can get our guests and our tourists that come to town to wear masks in public spaces when social distancing isn't possible, or when they're in an indoor space where they risk spreading the virus, we will protect our community. And that's my goal, is to try to protect our community. I don't want to end up with mass community spread and exponential growth of the virus, overwhelming our system, causing very negative health impacts to our populace and unnecessary death of the citizens of Valley County. I just don't want to see that. And that has no selfish motivation other than that I care about these people. And I know that we can do this.
Thank you, Dr. Irvin. Colby, did you get all your questions answered?
Yeah, thank you. I really appreciate the answers. And thanks again, Dr. Irvin, for being here.
My pleasure.
Tom, your turn.
Yeah, thank you, Dr. Irvin. I really appreciate all the work and research. So today I sent a message to Mr. Russell Duke, Central District Health Director, and I asked him if there are any statistics of infection in communities with mask ordinances and communities without the mask ordinance. And then I also asked if there was some comparisons between communities which took no action and communities which took various different actions, and then what was the most effective. So his response to me was that there is no definitive information at this time. Mask mandates are a relatively new concept, and I'm not sure how much reliable scientific information there is on the subject. And there's a lot of variables that will skew the data in one direction or the other. So a mandate with no enforcement and no compliance versus enforcement and great compliance would be expected to yield different outcomes. So there is a fair amount of research showing that face coverings seem to work to reduce, not prevent, transmission of the virus. While I understand they are inconvenient to wear, my thought is that a far better option would be to require them or strongly recommend rather than impose community restrictions and quarantine. And then he says he'll get back with more information if there is more. I guess my question is, there's a few of them, would be, you know, I know Dr. Irvin talked about his mask wear daily, but I'm assuming, Dr. Irvin, you're not wearing the same mask all day, correct?
No, I am required to change my mask between every case, and of course you would want me to do that. But the reason we do is that mask becomes contaminated by blood particles and aerosolized serum and whatnot from patients, and we certainly would not want to cross-contaminate between one surgery and another. So I change every time I do a new case, and that's for that reason. When I'm out in public, I do wear the same mask all day. And if it gets soiled or it gets wet or it becomes in any way problematic, I change it. If I wear a paper mask, but if I was wearing a fabric mask that was more attractive than the paper ones I wear, I'm sure, I would simply take it home at the end of the day, put it in the washing machine and wash it, and be ready to wear it the next day. And we know that washing and drying a cotton fabric mask decontaminates it and makes it usable again. So that's how I would handle that. So when I'm out in public, when I'm wearing one when I go to the supermarket or into town to go to the post office or whatever, I don't change my mask any more than is necessary.
Okay. Do all the different types of masks have the same effectiveness?
No, they do not. There are a fabric mask that's a homemade 2 or 3 layer cotton fabric mask, preferably with some kind of filtering material, piece of felt or something in between, works well. A surgical mask, which has some waterproofing characteristics, works a little better, a few percentages better in terms of particle transmission. An N95 mask, which is a mask that is, the 95 stands for that 90% of viral-sized particles are caught by the mask. 95% is the most effective. But N95s are hard to get because there's been everybody knows about the shortage of N95s, and B, they're hard to wear. They're hard to breathe in. I don't wear an N95 in the operating room. I rarely wear an N95. The amount of extra protection you get from an N95 is we're talking about small percentages, tiny percentages, and if somebody is directly dealing with a known COVID patient who is coughing and spewing virus into their face, an N95 is essential because it's filtering out 95% of the viral particles. But other than that, a surgical mask or a 2 or 3 layer cotton mask is just fine and does what we want it to do, especially if both members of an encounter are wearing it. And it's the person who is sick that is protecting the person that isn't sick. And the problem with coronavirus, the problem with COVID, is that we don't know who is sick and who isn't sick until it's too late. That's why we all have to wear masks.
Tom, any other questions?
No, I have no further questions. Thank you. Thanks, Dr. Irvin.
You bet.
Thank you, council. All of my questions have been answered. Dr. Irvin, I think you heard some very sincere compliments. On behalf of the council, I'd like to just share with you that we really have appreciated your advice, counsel, and being a good partner to the city of McCall from the very beginning of the outbreak of COVID-19 in our area. We really appreciate your help. Please stay online. We may have some more questions for you.
I'm staying right here.
Thank you so much. All right, we're going to move on to our next step, which is I'm going to call on council in the same order, and I would like you to share your insights of which option you would like council to explore further and perhaps take to a motion. Option 1 is urging people to do the right thing. Option 2, mandate, uses language that's mandatory, mandating people to do the right thing. So we'll keep track of it that way. Option 1, urging. Option 2, mandating. Mike Machezik, I'll start with you.
Well, so just a couple points. Thank you, Mayor Giles. The first point I'd like to make is for us as city council, I believe that our job as council is to represent our community. The second point I have is what we have received in public comment is overwhelming support for requiring wearing masks in indoor public spaces or where social distancing cannot be maintained. Number 3 would be I have personally reached out over the last 2 days, which is why my voice is a little bit hoarse, and have been speaking with people essentially nonstop. Numerous businesses in town, individuals within our healthcare system, and others within our community. And overwhelming, I hear their request that we pass the public health order that we are discussing. And as I said last night, if we require masks in indoor public spaces, I believe we increase the possibility that we can keep our businesses open and support the health and safety of our community. So I am in favor of, if that time comes in this discussion, to make a motion to adopt the resolution mandating requirement of wearing face coverings.
Thank you, Mike. Melanie, where are you leaning?
Honestly, I've been speaking with a lot of people as well over the last week or so. And while I realize that, you know, it's hard for a lot of people to accept being told what they must do. I feel in this case, we're not only protecting the health of our community, but we're also giving our local businesses something to fall back on as they deal with aggressive behavior. And, you know, if they need us to be that for them, I feel that we should be. So I am also leaning towards option number 2, a mandate.
Thank you, Melanie. Colby, you're next.
Yeah, thanks. I mirror Mike and Melanie's comments as well. You know, I think that it's important for us to try to find a way forward through this difficult situation that, you know, really there's not any winning outcome. All we can do is our best to try to prevent the rampant spread of this in our community, and our citizens, our business owners, and everyone who works in our community is in a very vulnerable position. I think it's important for us to be able to support those businesses and those employees the best we can. And I think that the option 2 is our only way to do that. short of, you know, going backwards in our reopening and shutting everything down. So, but I too am in favor of pursuing option 2. The one thing that I would like at some point in this discussion is to talk to Bill Nichols some. I have some questions. I think that there's concerns from folks out there, and I think we owe it to everyone to discuss some of those concerns with our attorney, as we've discussed those concerns with a medical professional.
We will definitely do that. Mr. Nichols is online with us tonight and will help us through that at that point. Tom, your thoughts?
Well, I don't care for the thought of fining anyone for non-compliance with a mask ordinance. I think that should be we should support our businesses who wish to have such a mandate on their business. But as far as a community thing, I'm not for it at all. The varieties of masks, all the different things, the way people wear them, there's just too many variables that ordering people to wear a mask is not going to account for. And then to encourage further police interactions between our citizens and somebody who's not wearing a mask, I'm definitely not for that. I think our police have a weekend with enough things to do. So, I'm for a resolution to encourage, but not for any kind of an ordinance or mandatory things. Thank you.
Thank you, Tom. So my thoughts as one of the 5 members of City Council, this is a pretty sobering thing, and I think we operate with imperfect data. Yesterday, we really wanted to know how widespread community spread is. There's a lot of things that we just have to operate and make good decisions, make the best decisions we can, and know that we don't have perfect data. But I think I fall into that group that's more comfortable being very proactive with option 2, trying a mandatory approach and seeing how that works. So that's where I would lean. I'm going to ask for a motion from council and someone to second that motion for option 2.
Mayor, can I jump in real quick before you go into your motion and just ask a quick question? Do you plan to go into deliberation and have us walk through the exact language of whichever one you're pursuing, or did you want us to do the overview of that before any kind of voting, to make sure that everyone understands, and the public and yourselves, what is contained in these documents, since they just came out a couple hours ago?
Yeah.
Or we can do it after, as part of your deliberation, after there's a vote on one or the other. Either way is fine. I just want to make sure that we go through it in detail for the public's benefit before there's a vote, a final vote.
Yeah, no, that'd be great. I'm going to let you do that for us. I would, in the interest of time, so that we can get through this tonight, I think we need a timely decision this evening, meaning sometime before 10 p.m. Would you please lead us through option 2?
Sure, let me get it pulled up.
Before she does, I would like to say you guys are a bunch of idiots. And I know Dr. Irvine, and I know he is an idiot, but I cannot believe that you guys are willing to take away people's constitutional rights over stupidity. I will be the first one to sue your sorry ass.
Okay, so I have the document up, and Bill is on
Mute
the,
the public.
Can I have a time for a question before we start with that?
So, City Clerk, do we have the ability, since tonight is not a public hearing, do you have the ability to have control over this where the city manager can present her information? And mute the people
Do we
that
have I think one of the problems, with this is that we don't have any input. A couple of hours ago, this came out, and the public has no input.
so the,
go ahead, Annette.
Mayor, I think what I would request is that the purpose, or explain, is that the purpose of this meeting is to go over this information. There is public input option was provided. The council's received over 200 pieces of email. We've received phone calls. Everything's been documented and provided to them. And so out of respect for the council and what job they're trying to do right now, I'd like to be able to present the information so that we have that into the recording for this meeting, which will be available for people to view later as well.
Please
Will
proceed.
there be any input before this is decided? After you put all the options in for 2, can the public read it and then have input? Because I feel like you are isolated and not giving us the opportunity.
The information is on our website and was available to the public already. You can see it on our website.
I believe the problem is that you gave very little time for public feedback prior to this meeting.
So I would respectfully request that the members of the public, I understand what you're asking of the council, but if you could please mute your phones and let us proceed with the meeting as advertised, and the council, I'm sure, is going to.
That's the problem. Muting the phones, that's the problem. We need input. We need to know what the community feels or how they feel.
I'm going to back her in that. I think that there's a lot of people that do not have internet service, have not had access to that site, and I think that the community as a whole needs to have more input before a decision is made.
Okay,
I
this is
feel details provided are very limited.
okay. This is Mayor Bob. We are proceeding to a decision on one of 2 options in front of us. I would appreciate it if the city clerk could help mute the audience.
Mayor Bob, this is the problem. This is the problem, Mayor, to continue without saying we are going to give you an opportunity at some time before we decide.
Hey, this is Colby here. We're not having to make a decision on anything tonight. We are moving forward on discussing 2 options here. I personally have a lot of questions for our attorney. There's a lot more questions to be asked. We're doing our best to ask the questions that we've heard from our community members and the people that we care about here. And this is not an easy decision, and we certainly do not have to make a decision tonight on this if we're not comfortable with making a decision tonight on this. So it would be helpful if we could continue the process here and continue our discussion. And I think that we hear you loud and clear on participation, and it is extremely important for me personally to have public participation. So thank you for speaking up, but I would appreciate it if we could continue on with moving forward through this so we can to get to the point tonight to decide whether or not we're going to adopt something or if we're going to table it and keep coming back. So thank you very much for listening and being part of the meeting.
all right, Annette, if you could help us go through that information, and then Colby, help me remember to be sure and ask our attorney, Bill Nichols, those questions that we had.
Okay. So the document entitled "A Resolution Mandating Requirement to Wear Face Coverings in Public Places," which is option 2, begins on page 7 of the packet. The initial statements at the beginning of the resolution are merely stating facts regarding the number of cases, the World Health Organization declaration of the pandemic, the President of the United States declaration regarding the pandemic, Idaho Governor Brad Little's declarations. So it is basically laying out the timeline and the facts related to the pandemic itself. And then it goes into the specifics regarding Valley County, Idaho, or McCall, Idaho, as a tourist destination, similar to other mountain resort communities in the Rocky Mountain region that have been the source of infection hotspots, such as Vail, Park City, and Sun Valley and Ketchum. That we're seeing increasing numbers of visitors from the county, or excuse me, from outside the county, we have a heightened risk of transmission at this point with our community transmission designation. There is a section that talks about St. Luke's McCall specifically, and that they serve patients from Valley County, Adams County, Washington County, Idaho County, and people from all other areas that are here as visitors. And that statement is in regards to their capacity and the intention of not overwhelming our local healthcare system in such a way that would result in preventable deaths. There's a statement about our vulnerable populations in McCall area, including our long-term care facility that has residents at high risk for exposure, and our senior community center that serves vulnerable and at-risk senior citizens. The next section talks about what COVID-19 is and defines the illness and the characteristics. And then the next couple of sections talk about the various studies and findings regarding transmission and outbreaks, and similar to what Dr. Irvin had already described regarding how transmission occurs from respiratory droplets. It cites a number of the studies that have been relied upon by the medical community. And then it goes into a description of how face coverings reduce droplet dispersal and why face coverings are shown to be an effective way to reduce transmission. It talks about the guidelines from the U.S. Centers for Disease Control that have been issued regarding use of cloth face coverings in public settings when physical distancing cannot be maintained. And then make statements regarding how other states and other areas in the United States have adopted similar requirements that decrease transmissibility due to the use of face covering could substantially reduce future death toll and negative economic impacts. And then it cites the provisions of your public health emergency ordinance that you previously adopted in March that allows you the authority to adopt this resolution. And then it gets into the specifics of the actual mandate. And so I'll go ahead and read that. Section 1, face coverings. Every person shall, when in any indoor or outdoor public place, completely cover their nose and mouth when members of the public are physically present for otherwise unprotected social interaction. Definitions. For purpose of this public health emergency order, public place shall mean any place open to all members of the public without specific invitation, including but not necessarily limited to retail business establishments, government offices, medical, educational, arts and recreational institutions, public transportation, including taxi cabs and ride-sharing vehicles. Members of the public shall mean persons not therein employed, present without invitation. And then we list exemptions for this requirement. The following exemptions would apply: children under the age of 5, persons who cannot medically tolerate wearing a face covering. A person is not required to provide documentation demonstrating that the person cannot medically tolerate wearing a face covering. Persons who are hearing impaired or communicating with a person who is hearing impaired, where the ability to see the mouth is essential for communication. Persons, including on-duty law enforcement officers, for whom wearing a face covering would create a risk to the person related to their work, as determined by local, state, or federal regulators or workplace safety guidelines. Persons who are obtaining a service involving the nose, face, or head for which temporary removal of the face covering is necessary to perform the service. Persons who are eating or drinking at a restaurant or other establishment that offers food or beverage service, so long as the person is able to maintain a distance of 6 feet away from persons who are not members of the same household or party as the person. Outdoor public places where a person can employ social distancing as recommended by the CDC, where the person is able to maintain a distance of 6 feet away from persons who are not members of the same household or party as the person. And lastly, persons who are engaged in indoor exercise, so long as they engage in social distancing. So those are the exemptions, meaning that the mask requirement would not apply to those situations I just read. This public health order does have a provision for penalties, which reads, any person who violates any provisions of the order shall be guilty of an infraction punishable by a fine of $100. Right now, the effective date and sunset date of the proposed emergency order is 12 a.m. on July 2nd and remain in effect until August 1, 2020, unless extended by the council. And so you have the authority to issue a public health order up to 30 days. And that is what the public health order describes. And that you've been referring to as option 2. And so I did notice that because we used the example that was voted on today and put in place by Blaine County, which is where Sun Valley is, there are a couple places in here, if council is going to pursue option 2, that we need to make a couple of Scrivener corrections that refer to Valley County and really should say City of McCall. And so, you know, those are, we can get that taken care of. And so if Bill Nichols wants to provide any additional description or explanation of what this order means, now would probably be a good time to do that.
I have an input to start this on tomorrow without the ability to present it to the citizens of McCall.
Bill, could you talk to us about this emergency order? Annette's question, please.
Oops, he might be muted.
So maybe while we're waiting for Bill to be able to join us, Colby, do you have some like 2 or 3 precise questions you'd like to ask Mr. Nichols?
Yeah, I mostly just wanted to kind of have a interaction with him on you know, the legalities of all of this stuff, just to put it on the record and get it out there for folks to hear about that. In addition, I think that it would be good to ask the chief some questions about enforcement, you know, because I think that plays into a little bit. And I think that maybe perhaps this would be as scary as some people perceive if we could have a little discussion on that openly as well.
Great. I'll let you lead that. Go ahead.
So, Mr. Mayor, can you hear me now?
Yes, Bill, you're coming through great.
Okay, thank you. So, in terms of the legality of being able to regulate this kind of behavior, or to ask for or require these masks, you tie this all back into, in terms of the federal Constitution, police power is within the powers reserved to the states in the 10th Amendment to the Constitution of the United States. Then in the state constitution, there's specific police powers, what are called the police powers, which is the ability to enact ordinances and regulations which are related to health, safety, and welfare of the persons within the jurisdiction. There's a specific constitutional provision in the state constitution that permits a city, in this case, to be able to exercise those powers. Additionally, the state legislature in Title 50 of Idaho Code has granted to the city the ability to enact public health ordinances and regulations. And so you go back to the ordinance which you adopted earlier in this pandemic, which is ordinance number 986, and there are specific provisions within that ordinance which permit the city manager and the city council to enact public health emergency orders. It's important to note that per your ordinance, an order is only good for up to 30 days unless it is extended by the city council. It's not an administrative decision that's made by the city manager. It's one that's a legislative decision made by the policymakers, the city council. So all of these, so we've got federal constitution, state constitution, state statute, city ordinance authority for this type of action. This is a legislative matter, meaning that it does not require a public hearing like a quasi-judicial matter does. Not to say that it might not be prudent to get some additional input, but certainly it's within your power as the city council to enact a public health emergency order as set out in this draft resolution that you have in front of you. I would also point out to you that you are not the only jurisdiction that is considering these kinds of requirements. So you're not going solo on this. There are other jurisdictions who have enacted similar, if not the same type language.
Thank you, Bill. And as your comment about, you made a comment about timeliness. We're expecting 20,000 people over the weekend. 4th of July is just a couple of days away. I would urge the council to, after all the questions have been asked, to make a decision tonight and not punt on this. So Colby, continue on.
Right. Chief, are you out there?
Yes, sir.
Yeah, I would just like to hear some of your input on this. I know that the enforcement is it's a tricky subject with this one, especially massive people that are expected to be in town, and you'll be busy with a lot of other stuff. I'd just like to get your thoughts on on how you might see this happening.
The enforcement aspect is something, as you stated, we will be very busy this weekend. We're continuing to operate below staff, and so we do not have staff to proactively go out and search for violators of this particular emergency order. I would anticipate that it would continue to be an educational process as we've treated the previous mandates from the governor's office. However, it would be another tool within our toolbox that we would be able to use in specific situations in which the need arise. Perhaps we have to remember that this emergency order primarily applies to times within enclosed buildings and such. So if there were areas with large groups of people that were violating it, perhaps a citation might be necessary, perhaps it wouldn't. And so to tell you whether or not exactly if it is strongly enforced or partially enforced, there's really not a good answer for that, unfortunately, because there is the discretionary aspect that's there. I can tell you that as the administrator and the chief law enforcement officer for this city, that it is not something that we would send our limited resources out on a continual daily, minute by minute, hour by hour search for people that are violating this particular emergency order. It is in the best interest of the public, I believe, that this mask order is implemented. I will be, as well as my staff will be, responsible for the enforcement of it within the city. It will fall upon us. And so the reality of the matter is that we will use it when it's necessary to use, but we would prefer to continue to educate people and hope and urge that they do respect the others within the community and that they take action on their own and hold themselves accountable, hold their family accountable, their friends accountable, rather than pushing it off onto someone else for enforcement action.
Great, thanks. I just wanted to hear your thoughts on it. I appreciate it.
Well, I appreciate the opportunity to provide the input, Colby. Thank you.
Thank you, Chief. Colby, any other questions that you had?
No, I think that's it for now. I just wanted to make sure we kind of covered a few bases there with a lot of the concerns. Clearly, this is a major issue.
I agree. Thank you for helping facilitate that. I really appreciate your help with the questions for Mr. Nichols, our attorney, and for our police chief. Annette, I'm going to ask your opinion. Do you feel we have covered material well enough that in good conscience we can proceed to making a motion? Or do you have any concerns?
Well, I think that's a question for your colleagues. I have provided you with the information that's in the draft resolution and public health order so that it's clear that the provisions only apply in certain circumstances and that there are exceptions to it to address some of the concerns I think that were in your public comment regarding medical necessity issues, asking you to make sure there's clarity around what types of indoor spaces this would be required in, and that it's not just a blanket, you have to have a mask on 100% of the time. It's calling out specific situations where it's necessary when you're in a public indoor space or in an outdoor space where you can't achieve physical distancing. So I think that the material spells that out very clearly. And then the other comment I heard around businesses and supportive businesses. We have had conversations through the Chamber of Commerce about our ability to respond to an individual location if a business owner needs help and has called us due to a belligerent or unruly customer. And so even without the order, if a business has their own business policy in place and are having difficulty with a customer, they can still call for police assistance if it's necessary, because trespassing is still an available remedy. However, that's not addressing the bigger public health protection picture, of course, but we do have a lot of businesses in town that have already put in their own policies, and I think they are looking to the council to see if you support that and if you're able to provide a broader umbrella for that measure, for that protection. So I'm happy to answer any other questions that council may have, and if you all are comfortable with moving forward with your deliberations, then go right ahead.
Thank you, Annette. I really appreciate you helping us with that. Let's start the formal deliberation process. Mike, are you feeling comfortable with an option, or do you have more questions or statements you'd like to share?
Thank you, Bob. I would hold with my comments previously.
Thank you. Melanie?
Same.
Thank you. Colby?
Yep, same here.
Okay, thanks. Tom?
Well, I guess since we're not going to go with any data, we're just going to go off the cuff. I guess we'll just go to a vote.
Okay, that's your opinion. I am in favor of option 2. Would someone make a motion, please, to adopt the resolution that uses the mandatory language referred to as option 2?
Do we have a resolution number?
With the, we'll get a resolution number here in a minute. And would we also add the language about, I think you, Annette, referred to as Scribner changes, is that correct? Edit?
Yeah, there's a couple references that say Valley County that I think we need to double check with Bill. That I guess that's a question for Bill right now. Is that okay because our public health authority extends 5 miles out beyond the McCall city limits under the statute, that we just leave that references to Valley County, even though it's really not the all of Valley County, or should we change that? I just don't want it to be confusing.
Okay, let me look again where those are.
And then my other question in response to some of the feedback you heard from the people online a few moments ago is making sure you're comfortable with the effective time and date, and whether you want to give that another day to July 3rd for people to prepare or not.
I think if we're trying to be effective, as Dr. Irvin suggested, we need to make a decision tonight.
I mean, just the effective date of the order when it goes into effect, not when you vote necessarily, but just do you want to give the community more notice after your vote tonight of when this is going to start?
Don't you legally have to give us notice?
Mr.
We
Mayor?
did give notice on the agenda, and ma'am, if you continue to interrupt, I will disconnect you.
Go ahead, Bill.
Yeah, Mr. Mayor, I mean, I realize that members of the public have an interest in this, but really this is not a public hearing and there should be no interruptions of your deliberation except as you permit.
I have tried to explain that, but people are not honoring that. So I'm going to ask Bessie Jo to disconnect folks if they continue to interrupt. So Annette, in response, unless I hear otherwise from other council members, I think we have a responsibility based on Dr. Urban's input and others to act tonight and to put this into effect as soon as possible. As I said earlier, people are moving into town as we speak. We expect as many as 20,000 people probably by Friday. So today is Wednesday night. I would recommend this go into effect as it was written and noticed for this meeting tonight. Anyone have an objection to that on council?
I do.
Please speak up, council. Identify yourself. Okay.
Are you asking for input?
Is that someone from city council? I'm sorry, I need some
No,
help on
sir,
that.
I'm the only lady on city council and it was not me. Thank you.
Thank you, Melanie. Appreciate it. All right, let's proceed.
I'm sorry, Bob. What are you asking? It got very convoluted there just for a moment.
What I'm asking for is for the council, are you okay if we make a decision tonight? And I believe, Annette, help me out. It goes into effect if we make a decision tonight when?
12 a.m. July 2nd.
Correct. Is council okay with implementing that? I assumed you were. You had this material this afternoon and I haven't heard anyone balk at that, but I'm just trying to confirm that.
Bob, this is Melanie and I am perfectly good with that.
Thank you.
Mike, I confirm.
Okay, Colby?
Sorry, I've been having issues trying to unmute my microphone here. Can you hear me?
Yes. We can't hear you, Colby.
I kind of have mixed emotions about moving forward tonight. I know that time is of the essence, but I'm also concerned that this ordinance just was put out this afternoon. The website very shortly before this. I know which way I'm leaning, but I know that it's also important for us to get thorough public input, which I think it's shown that we have gotten a lot of input, but a lot of that input was before this ordinance was drafted. So I think, for the sake of hearing our community's voice, I would feel like we still have time to make a vote on this tomorrow, but that is my opinion.
Thank you, Tom.
Hey, Bob, this is Tom. I 100% agree with Colby that we do not need to vote on this tonight, and that we should give at least till tomorrow to allow the public to digest some of this information.
So Annette, is this an emergency? And Bill, I guess I need your help. Let's go back and revisit that. This is for 30 days. And it is under the emergency language. Is that correct? Could you preface that again?
So, Mr. Mayor, Council, there's a couple of things that you need to be aware of. Certainly, you are not required by law to take a vote tonight if you don't want to. However, I would recommend that if you do not vote tonight, that you simply put your meeting in recess until a defined time tomorrow, because you don't have enough time right now to notice a special meeting unless you want to have the meeting at 7 o'clock tomorrow. Because you'd have to re-agendize and publish a notice. If you go into recess until tomorrow at whatever time, 3 o'clock, whatever time you decide, then you can do that. You can recess this meeting and continue it to a date and time certain. And then you're not required to re-agendize. It might be a good idea to send out an agenda of the continued meeting, but you're not required to. That's the first thing. The second thing is you could shorten the time for this emergency order to something less than 30 days. If you wanted to, for example, hold a special meeting to receive public input, you could set this out, for example, to July 17th and hold a meeting the week of the 13th. You could add it to your agenda on the 9th with a deadline expires unless extended as July 10th. So you have some options with regard to the length of the order and how you might adapt that to get additional public input.
Great idea. So hold on a minute. Dr. Irvin, are you still on the line?
Yes, I'm still here.
So do you agree with my urgency? I don't think waiting a couple of days is going to change the council's decision, but am I the only one that senses some urgency about implementing this? What's your thoughts? What's your advice to us?
Well, the 4th of July weekend starts tomorrow. Highway 55 will be bumper to bumper from Ada County to Valley County, beginning tomorrow afternoon. And we will have a lot of folks here. The sooner we get this implemented, the sooner we reduce the risk of viral spread. There is a huge influx in both Canyon counties or a huge increase rather in both Canyon County and Ada County of cases, many of whom don't know that they are carrying the virus. And if we can get masks on folks that are arriving tomorrow, obviously logistically it's going to be tough, but I do have a sense of urgency about this. Which is why on Monday I requested that the council consider this resolution.
Okay, so how about
I'm coming.
How about we do this then? Bill, you said that we could shorten the time period, provide for some more public input, monitoring it on the July 9th meeting. You had some suggested dates, like maybe a couple of weeks instead of 30 days. How about we go for that and let's get through it tonight?
Bob, this is Melanie.
Yes.
And I think this is what you just said, but I just want to make sure. I have some concerns I understand Colby's desire to wait for at least another day, but we're severely impacting our ability to put out the message to the valley if we wait.
Correct. So would council be okay with those of you that want to vote for this mandatory? Would you be okay with Bill's proposal? I think you said, Bill, the 13th. Is that like 2 weeks? And we would have. Go ahead.
Yeah, you can decide what you wanted to do. The other thing you could do is you could leave it at the 30 days and you could still get public input and revisit how long you want to keep it. There's nothing to say you can't amend or revoke this resolution later.
Okay, let's go with that proposal. Would someone make a motion, please?
Bob, I think we need a resolution number to make a motion.
Joe, can you help me with that?
20-12.
Thank you. It's resolution 20-12.
Bob, may I make a motion?
Yep. I'm
This is,
listening.
this is Councilmember Machezek. I'd like to make a motion to adopt Resolution 20-12, a resolution mandating requirements to wear face coverings in public places as described, subject to Scribner's corrections, RE the City of McCall, not Valley County.
Second, Bob, this is Melanie.
Thank you. A motion to adopt resolution 20-12 has been made and seconded. Is there any further comment from City Council before we do a roll call vote? Yes.
Bob, Mayor, this is Bessie Joe. I just don't see the phone callers anymore, but Bill is still on the line, so I guess they're all still there, but I just don't see any of them.
We're here.
Okay, great.
That's fine. So procedurally, we're okay, right, Bessie Joe?
Yep.
Okay, so let me call for a roll call vote, please.
Councilmember Machezek,
Yes.
Councilmember Holmes,
Yes.
Mayor Giles,
Yes.
Councilmember Nielsen,
Yes.
Councilmember Sowers,
No.
Thank you, council. The motion passes. Bessie Joe as our clerk and Annette as city manager, and Bill, do you think we captured what that motion is? And if any edits are needed, we can take care of that and put it into motion tomorrow?
Yes, I think so. But Bill?
Bill, are you okay with our procedures tonight? Have we effectively followed the right rules on passing that motion?
He might have been one of the people that got dropped off.
Okay.
Hopefully you can get back on here real quick.
All right.
Is it legal?
If someone could call Bill, please, and then,
Sorry.
Here he is.
Mayor and council, I apologize. I have a mute button on my phone too, and I thought I was unmuted. So unfortunately, just as the motion was made, my call dropped, so I did not hear the motion.
I think Bessie Joe
Are you
can
there?
read it back to you.
Bessie Joe, can you help us with that?
Well, I was having some technical difficulties, but basically, Councilmember Machezek moved to adopt the resolution that mandates the masks. And then Councilmember Holmes seconded it. Do you need the exact verbiage?
The motion was he moved to adopt resolution 20-12. And then Melanie seconded.
And then the council voted, we did a roll call vote. It was a 4-1 vote in favor.
Yeah, Mr. Mayor, I heard the roll call. I just did not get I was able to get back on. I just didn't hear the motion. That's an adequate motion to adopt this resolution.
You said that is adequate? We are legally sufficient, Bill?
Yes.
Thank you. All right. Annette, do you think there's anything else we need to discuss, or should we adjourn tonight?
Well, I think the business of the council is complete, and the staff will be issuing a media release, and we'll start immediately getting the word out about this resolution that you've adopted tonight.
Thank you. Council, thank you for spending spending a lot of time today preparing for this meeting and coming in with very good questions and comments and working together. I really appreciate it. I would look for a motion to adjourn.
I feel very unrepresented.
I would look for a motion to adjourn, please.
Motion to adjourn, Mike?
Second, Melanie.
Thank you. Motion has been made and seconded to adjourn. All in favor, aye?
Aye.
Aye. Anyone opposed? This meeting is adjourned. Thank you.
This is
Thank you.
Dr. Irvin. Thank you all very much.